On October 22nd, 2009, I got a call from my sister Lynn letting me know that my mom had been diagnosed with leukemia. As we flew to Florida the next day to support her through the tests necessary to identify her specific type and determine treatment options, I began to compose a list of questions to ask her oncologist. Were we, her children and grandchildren, at risk for developing the disease? And if so, was there some kind of genetic testing available to detect it? The mapping of the human genome created new opportunities for the application of genetics to predict, prevent, and treat many diseases. Yet, as with many scientific discoveries, it has taken years for public policy to catch up with the science. Many Americans were concerned that their genetic information would be used by insurers to deny, limit, or cancel health insurance coverage, or be abused by companies to make employment decisions. As a result, lawmakers, scientists, and health advocacy groups determined that there was a need for federal legislation, and in 2008, the Genetic Information Non-Discrimination Act, or GINA, was signed into law in the U.S. Today, there are over 1,000 genetic tests for specific human conditions. These voluntary tests can be used to confirm or rule out a diagnosis, identify one's risk for developing a particular disease, or determine whether an individual or couple is at risk for having a child with a particular genetic disorder. They can even be used to help doctors determine the best course of treatment or the optimal medication dosage for their patients. However, there can be emotional and social consequences associated with the choice to undergo genetic testing. Results may not always be able to predict the age of onset or severity of a disorder, or even whether the individual will actually develop the disease in the future. Feelings of anger, guilt, anxiety, or depression can affect the individual being tested as well as their family, particularly if tests reveal an unsuspected risk or if someone does not want to know the results. In some cases, genetic tests can also reveal family skeletons, such as non-paternity or an undisclosed adoption. If you were at risk for a genetic disorder, would you want to know? Currently, the federal and state government decides what each of us must be tested for at birth. In Virginia, newborns must be screened for 31 specific disorders, including cystic fibrosis and sickle cell anemia. One of the current goals of the National Institutes of Health is to cut the cost of sequencing an individual genome to $1,000 or less. They believe that by making testing affordable, this will allow healthcare professionals to create a personalized preventative plan tailored to your specific DNA. Although knowing the risks you may face would allow you and your doctor to make better decisions regarding your health care, I believe that it should be your decision, not the government's, as to which genetic tests are performed. As it turned out, my mom's type of leukemia was not hereditary. Yet, I wonder if it had been, would I have opted to undergo the testing? Given that there is currently no cure for her type of leukemia, I'm not sure that I'd really want to know.